Welcome back. Less than a month after all coronavirus 19 restrictions imposed by the state of Maryland and Montgomery County were lifted, it was disclosed this week that Montgomery County is now making contingency plans in response to the increase in the Delta variant COVID cases. Laurie, the headlines in the media report in alarming detail that we are in the midst of a surge in COVID-19 cases. But if you look at the county COVID-19 dashboard, the statistics suggest only a small uptick in reported cases, and that an inpatient hospitalization of COVID-19 patients is actually less than 1.1%. So is the news media accurately reporting what is going on?
Yeah, the news media likes to spread fear because that's good for business. But there were 61 cases in Montgomery County today as we're taping, and there were over 500 cases in the state of Maryland. So I do think there is a cause for concern among the unvaccinated. But for the vaccinated, I just think the messages are not consistent when it's very confusing. There's 3 points I want to make. The first is that there's not a comparable increase in the number of hospitalizations and deaths when you look at the number of cases. And the people that are in the hospital, or most of them, are the ones with who've not been vaccinated. The second point is that wasn't the goal in the beginning of the pandemic to slow the spread so that we would have room in the hospitals, but there's 1.1% in the hospitals with COVID right now. That's a good thing. And Fauci is now saying the reason is that we're putting our masks back on is because of a change in the virus. Yet he says it's okay, that we're protected if we're fully vaccinated. That's confusing to people. The third point is that we've seen Texas today had over 10,000 cases. There are people crossing the border who are infecting other people. And why is the Biden administration not doing anything about that? Because there's people coming through the border and spreading it, and we should be reinstating those Trump policies to, if they really mean business, we should start seeing some changes there.
Well, let's stay focused here on what's going on in the county. And Mike, nobody in their right mind would want to go back to lockdowns again.
Right.
And as Laurie pointed out, the number of fatalities in the county attributed to COVID-19 in June, which was the most recent report, was 13. And not to diminish or those fatalities in any way, but to put it in context, at the height of the pandemic in April of 2020, for the month of April, there was 284 deaths. So there's a different magnitude. So are we overreacting to some small increases in infections?
Well, I think, and Laurie referenced this, I think biology does change things. So the virus has mutated and it does different things. And so to think that there's a static environment, that's not how biology works. And so while people want to think that's confusing, yeah, it is. But that's how biology and science operate. So we need to pay attention to it and try and get ahead of it. That being said, I don't think it's horrible to have a contingency plan, but I agree with you. I think the numbers that we have so far in the county indicate that we've done a good job. We have more than 70% vaccinated, at least with a single dose. And so I think those things have worked well. My concern, I think, the place we got to pay attention to is the transmissibility of the Delta variant, and people can carry that, and the transmissibility of it, I think, impacts our children. We know those under the age of 12 are still vulnerable, and so I think we have to pay attention to that. I don't think we have great answers for that, but I think we need to know and we need to pay attention. We shouldn't be putting them at risk when we know that there are challenges out there to be addressed.
Well, that may be true, and we don't have time in this segment to really get into the details. But, again, children or individuals under the age of 18 are the least susceptible to COVID-19 and problems from COVID-19. So again, it's a question of a balancing between what is healthy for children and what is unhealthy. And there are reports that say mask wearing on a regular basis for long extended periods of times is not healthy for children.
But we are also seeing an increase in that population with the Delta in response to the Delta variant as well. And so again, I don't disagree. I think, to your point, there is a middle ground that needs to be achieved, and we need to continue to strive to get to that point. And having a contingency plan, I think, helps us get there, but I have yet to see any indication or any benchmarks to say how those contingencies ultimately get put into place. And I think it's pretty important to make that really clear to folks what the next steps would be.
Yeah, but the idea that a mask, and this is a Fauci mask, it's a Washington National mask, is going to protect us and protect everybody, I think is foolish. I think vaccination is the way to go.
Sure it is. Sure it is. But we've got 100 million people out there that don't want to get vaccinated. So what do we do when that doesn't work?
Well,
and they're getting more firmly entrenched.
They have the right and the privilege of not being vaccinated.
Well, then what's our next step? Because they're the ones that are now spreading the virus.
You can spread the virus even if you've been vaccinated. This is a really devilish disease that we're dealing with.